Have you ever wondered why your doctor tells you to take one pill once a day, but another one has to be taken, say, every 4 hours? Well, it's not random at all. It's actually a really precise science that's all about how your body handles medication. And today, we're going to pull back the curtain on the kinetics of elimination.
So, here's our game plan. We're going to follow a drug's journey right through your system. We'll start with the body's own cleanup crew. Then we'll crack the code of a drug's internal clock. From there, we'll see how it hits that perfect therapeutic sweet spot, discover that not all drugs actually play by the same rules, and then we'll tie it all together to see why this science is so crucial for your health.
All right, first up, let's meet the body's cleanup crew. The second you take a medicine, your system just kicks into high gear, and it starts working to process and remove it before the next dose even comes along.
So how does this actually happen? I mean, where does the medicine go after it's done its job? Well, the answer lies in a couple of our body's most powerful organs.
The liver is pretty much the command center for this whole operation. You can think of it like a super sophisticated processing plant. It works together with the kidneys, just tirelessly breaking down drugs and getting them ready for removal from your bloodstream.
Now, to measure just how good this cleanup crew is, we use a concept called clearance. And this isn't just about raw speed. It's about the rate of removal relative to how much of the drug is actually in the blood. That's a crucial point, and it's what makes clearance the single most important and complete way to measure drug elimination.
And to really get clearance, you also have to know about the extraction ratio. This basically tells us how efficient an organ is. So if blood carrying a drug flows into the liver, the extraction ratio is the fraction of that drug the liver manages to grab and remove in just a single pass. A high ratio, that means a very, very efficient liver. Now here's where it gets really interesting. There's this thing called first-pass metabolism. For some drugs like the ones you see here, the liver is so incredibly efficient that it removes a huge chunk of the medication right after it's absorbed, before it even gets a chance to circulate through the body. This, of course, dramatically reduces the drug's availability.
Okay, so we know how the body clears drugs, but that just begs the next question. How long does it take? This is where we need to talk about the drug's own internal clock.
And this clock is called the half-life. It's a really simple but powerful idea. It's just the amount of time it takes for the concentration of a drug in your blood to drop by exactly 50%. This one number dictates pretty much everything. How long a drug stays active and, you guessed it, how often you need to take it.
And this whole process follows a really predictable pattern. So if you start with 100% of a drug, after one half-life, you're down to 50. After a second one, you're at 25. After a third, 12.5, and you can see how it goes. It's this predictable decay that lets doctors calculate dosing intervals just perfectly.
So how many half-lives does it take to get a drug almost completely out of your system? Well, the clinical rule of thumb is about 4 to 5. By that point, more than 90% of the drug is gone. And interestingly, this same magic number, 4 to 5 half-lives, is also how long it takes to reach a stable level when you first start taking a medication.
And that brings us to the ultimate goal for most drug therapies, finding that therapeutic sweet spot. We don't want too much drug in the system, and we don't want too little. We want it just right.
This sweet spot has a name. It's called the steady state. It's this perfect point of equilibrium, where the amount of drug you're taking in is perfectly balanced by the amount your body's getting rid of. This is what keeps the drug level in your blood consistent and right in that effective therapeutic range.
So, how do we hit that perfect balance? Well, there are 3 key rules. First, the time it takes to get there is all about the drug's half-life. It's always going to take about 4 to 5 of them. Second, the level you end up at depends on the dose. You take a higher dose, you get a higher steady level. And third, if you take smaller doses more often, you keep the drug level much smoother, with fewer big swings between the peaks and valleys.
Now, you might be thinking that all drugs follow these nice, predictable rules, but this is where the plot thickens a bit. We've got to talk about 2 very different sets of rules, or kinetics, that control how drugs are eliminated. Okay, so most drugs follow what we call first-order kinetics. This means your body gets rid of a constant fraction, say 10% of whatever drug is there every single hour. The more drug there is, the faster it goes. But a few tricky drugs follow zero-order kinetics. With these, the body eliminates a constant amount, like 10 milligrams, every hour, no matter how much is actually in your system. And the differences here are huge. In first order, things like clearance and half-life are constant and predictable. But in zero order, things get weird.
The rate of elimination is fixed, which means that clearance and half-life actually change depending on the drug concentration. This makes these drugs much, much harder to dose safely. And here are some of the key players that follow these unpredictable zero-order rules. Things like warfarin, alcohol, aspirin, and phenytoin. Because their elimination rate is fixed, even a tiny increase in the dose can cause a dangerously large and potentially toxic spike in your blood concentration.
So why the two different rule books? Well, it all comes down to the enzymes in the liver that are doing all the work. Think of them like checkout cashiers at a supermarket. For most drugs, there are always plenty of open registers. But for zero-order drugs, the concentration gets so high it's like Black Friday. Every single cashier is busy. The system is just running at max capacity, so it can only process a fixed number of customers at a time.
Whew, okay, we've covered a lot of ground, right? From clearance and half-lives to these two different sets of kinetic rules. So let's bring it all home and see why this isn't just for a textbook. It's absolutely fundamental to your health and safety.
This quote really just gets to the heart of it. Every single dosing decision a doctor or pharmacist makes is based on these principles. They use this knowledge of a drug's half-life and its kinetics to make sure you get all of the benefit with the absolute minimum amount of risk.
At the end of the day, this is the big takeaway. Understanding these concepts is what allows for the personalization of medicine. It's how your doctor figures out the right dose for you, how often you should take it, and most importantly, how to stop a drug from building up to dangerous levels in your body.
So, the next time you look at a prescription bottle, you'll have a much deeper appreciation for all the science behind those simple instructions. Your body has this incredible system with a clear set of rules for handling what you put into it. Now that you know what those rules are, how does that change the way you think about the medicine you take?